Welcome to Keiser Voices, the story of success, brought to you by Keiser University Graduate School, here where the academic world meets personal triumph. Join us today as we dive into the captivating tales of success.
Welcome back to another episode of Keiser Voices, and we're excited to spend the month of May talking about mental health awareness. It's a topic that I think you'll get from our conversation today is underspoken. And joining us today is Dr. Joe Oravecz, who is the Chief Executive Officer of NAMI Broward County. Thank you for joining us, Dr. Joe.
Oh, well, thank you so much for the invitation, Heather. I'm really looking forward to the conversation, sharing this information, not only with the Keiser community, but beyond. So thanks again.
Oh, thank you. And I do want to state out to our listeners, as a forewarning, we are going to be talking about mental health, and sometimes that can be a hard conversation to have. So there might be topics or parts of this conversation you might find concerning. So, please proceed, with caution with this conversation. We are talking about breaking the stigma and the importance of those mental health conversations and why they matter. But I don't think we could not start off giving you all a heads up about this conversation. So, Dr. Joe, I want to talk a little bit about your background. As I introduced, you are the executive officer for NAMI Broward County, NAMI being the National Alliance for Mental Illness, but you've served over 25 plus years working in higher education, serving in roles as oversight of counseling, administration, campus life, student services, housing, veteran support, athletics, campus activities, student conduct, residence life, academic advising, and I'm sure I'm missing items, but you have an extensive background in higher education. So I think it's safe to say you've seen mental health from all aspects. But one of the things I want to bring up is a quote I have of you saying before I ask you my first question. And the quote that you said, one of the most significant barriers to mental health care is stigma. It's a veil of misunderstanding and prejudice that can prevent individuals from reaching out for help. I am committed to tearing down this barrier through education, open dialogue, and advocacy. That was a quote from you that I got from NAMI, from your own personal website, from your own personal social media, which kind of leads me to my first question for you. Why is there still a stigma around mental health? How do we get around it?
Yeah, and well, thank you for finding that, because it's something that, to be able to live authentically, of understanding where people are coming from. And I think generationally speaking, I would say that the younger, quote unquote, younger generation of Generation Alpha, now the COVID generation, Generation Z, even millennials, have more of an awareness and appreciation about mental health compared to the more seasoned generation. And I think predominantly there are outdated beliefs as far as what mental health, when you think about what society, what the movies, what social media 20, 30, 40, 50 years ago, as far as we just don't talk about it. That's something that we don't want to do there, because there's a fear of being seen as weak, the lack of visible leadership in your community of talking about mental health. It's easy for everyone to talk about physical health. If I have an ailing back, or if I need to have an operation on my foot or a shoulder, to an extent, that is a very easy conversation. However, when people are talking about mental health, they just don't want to talk about, because dependent upon, again, ageism, is that we just never talked about it in, quote unquote, in my generation. The other piece is that in talking about mental health in the workplace, is that the workplace culture matters. And right now we know that through a NAMI study is that 58% of employees still feel uncomfortable discussing mental health at work, despite 75% saying that it's appropriate to talk about mental health. So there's the tide is shifting, but we need to combat this stigma by normalizing the conversation. And that starts from the top and showing that mental health is health. It's not a character flaw. And we need to firmly understand that. I think we're getting there, but it's just acknowledging that it's part of our holistic health. So that's the extent, and I think, and we can talk about more of what that might look like, but that's the beginning, I think, of our conversation.
No, I think it's true. And you would think, and I've read some studies and just from interacting with people post-COVID, you're starting to see this transition into saying it's okay. And this is NAMI's. I'm a big fan of NAMI, and we'll talk a little bit about NAMI at the end for those of you that have never heard of NAMI. But NAMI saying is it's okay to not be okay. And it's a whole movement that we have seen post-COVID. So in a way, I think mental health was at its highest during the times of COVID. And I think that's where we start to see the shift. I mean, it's not like if you tell me you have anxiety or you have mental health concerns, and I'm going to throw out an old term here, a sanatorium, we're not sending you to a sanatorium because you're different.
Right. You're absolutely right. And I think that's where I say with COVID that crisis begets opportunity. So those of us that were always in it as far as mental health and for me being at the universities across the country of understanding where we need to support students holistically, including mental health, that was before March of 2020. Mm-hmm. However, again, crisis has now begotten an opportunity whereby that sense of isolation, loneliness, anxiety, depression, sedentary lifestyle really was metastasized during COVID. So it allowed people to talk more about mental health. And so with that, of riding the wave of now is our opportunity for dispelling that stigma. A lot of us in that area of mental health awareness prior to March of 2020 we're now saying during and after COVID to an extent. It's like, well, welcome. We've been talking about this, but now now that people are understanding it more and more, this will be with us for the foreseeable future. So how can we have this as part of our conversation? As I already indicated, is that mental health is health. So how do we talk about that? How do we do it in the workplace, in our community, in our associations, be it, the after work and the weekends and the family as well?
How can we create that environment where individuals are comfortable saying, I need help, or seeking out those resources?
Yeah, that's where I firmly believe, and this is a presentation that we're doing more and more, and I'm doing is with that stigma-free workplace, and that's no matter how you want to define workplace, and it's really that leaders must model the openness. People are waiting to see leaders talk about mental health, and employees are much more likely to talk about mental health if their leaders first show that vulnerability and that transparency. And so that's where people need to just get comfortable with the uncomfortableness, because the more that we talk about it, then we become comfortable and start normalizing that conversation. And it's hard, but it's those leaders that are saying, I need to do this. This is really important. That's even how I found, even through my own mental health journey, of being very transparent about that. It doesn't happen automatically. It takes time to get there. But it's a lot of emotional intelligence, self-actualization that then indicates, hey, well, the hope here is that as leaders are starting to share that information, the workforce will be able to say, if he or she is able to talk about it and be able to seek that support, then I can do that too.
I guess my next question for you is kind of similar to what I just asked you, but kind of taking it away from comfort to conversations, right? So I'm going to stick with the C's here. So for them to be comfortable, like you said, we have to have those conversations. So whether you're a university like we are here at Keiser or another institution, how do we encourage those open conversations about mental health? Is it still from the top down or just amongst our peer groups?
So, kind of thinking, well, let's approach it kind of really university and workforces. So really from the university standpoint, and as you have new employees coming on board, so there's still, you have that orientation theme there, is that it's the adage of start early and start often, meaning that integrate mental health, the awareness, the services, what we believe, what are our core values, into the onboarding, into orientation, and with faculty in the university, including that in syllabi and student leadership training and campus life, that we know it, we embrace it, we want to learn, we want to support you through that. And from an employee, from a workforce standpoint, is building that psychological safety where asking for help is seen as smart and responsible and not risky. That's where it's too much that people just want to hold it close to the chest. It's, again, going back to, well, people will just think I'm weak, and that's not the case. But it needs to be spoken about. And from a university standpoint, it is training and educating, through workshops and such with faculty and staff, and we know that students often go first to a trusted professor and not counseling centers. And so it's like, what are the tools for faculty to equip to respond appropriately? We're not asking everyone to be licensed clinicians. However, it's what are the tools in the toolbox that we can appropriately refer? And that is where it's normalizing the conversation through, storytelling is always wonderful, and inviting leaders and alumni and peers to share their mental health journeys. That's really when you start sharing that, you're giving permission for others to say, yes, hey, I want to be able to seek additional support. And that's where, and to make mental health visible, because it's kind of that invisible type of struggle. And you just don't want to hide it behind clinical services. It's promoted through wellness events and mental health days and peer ambassadors. So that's those kind of different components that you want to be able to think about. And from a workforce standpoint, when I talk about training and educating faculty and staff at the university, similar with managers, is recognizing the warning signs and how to guide your direct reports or others to resources. We always want to think about and promote the confidential, easy to access resources. And this is at universities or any other workplace when you have the available of the EAP, or the Employee Assistance Program. So that they are confidential. Usually I've been going into companies now to reinforce that it is confidential. Some people think that, well, no, it's not. It is. And then I explain a little bit how it is confidential. And then from the university, clearly then going back to the campus mental health centers, because it's the low barriers that you want to be able to provide. And it's all about resilience and recovery and leadership that involve the mental health support. So that's kind of bottom line. It's leadership visibility is absolutely critical and key, because the employees, students will feel most comfortable when leadership openly prioritizes mental health.
Now that makes a lot of sense. Like, nothing that you're saying is anything outlandish or crazy. And it seems simple, but yet we still have that stigma. We still have that fear of even asking for help. And a lot of times too, self-care becomes really important into that. And so I kind of wanted to bring that up before we go back to the topic of resources, because I have a feeling I'm gonna have a lot of questions for you when we start talking resources. Yeah, but self-care and self-awareness is very much a part of that conversation, and not just once in a blue moon. It's daily.
Yeah. And I think that's where leaders within organizations, be it a university or nonprofit or for-profit, that to be able to openly articulate as a leader as far as what I'm personally doing for self-care. You need to tell the story and be authentic about it. And to an extent, sometimes it's redefine what self-care is. It's not only spa days. It's setting boundaries. It's saying no. It's breathing intentionally. It's resting. And it's more or less as to that go, 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 go culture that, I think what we're known for, unfortunately, within, I think, the United States culture of go, 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 that when you look at other cultures around the world, it's not necessarily that. And what is the life expectancy in other cultures and such? It's because there's much more of an awareness, a holistic awareness, that boundaries, time away, turning things off so you're not constantly on. And that is over the overarching of what self-care is. And to also recognize, and this is a deep dive of self-actualization as to how do I get my energy, or how do I reset to get my energy. For me, it's from a healthy standpoint of working out, trying to eat as healthy as possible, getting outside, taking long walks, and an avocation for me is music and singing and such. And that's just something that I've realized when I don't have it, I try to do a body scan to an extent, saying what's going on, what am I missing, what's happening, and realizing, okay, I'm missing certain pieces within my life that create that holistic approach. And so that's kind of where, anchoring self-care into your own daily routines. If it's micro breaks between meetings, and that's even, and I think COVID did us in from a sedentary lifestyle. And I knew that as soon as the world was shutting down, I was working on the college campus, that I knew immediately it's going to be a sedentary lifestyle. No one's going to keep moving. And how do we keep that going? Because and we know even with the elderly that when you become sedentary, it worsens your health. And so how do you keep those? So the micro breaks are really important. Gratitude is really important as well, and walk and talk. So it's keeping yourself moving. Movement has a significant impact with your overall mental well-being. And so it's just really building it into your everyday routine. Even, as you're watching TV and trying to just say, I just want it. And for me, I do that. It's just like, I want something mindless that I can laugh at. But in the meantime, I can stretch. And so that's kind of overlapping a couple different things. And people are like, well, that's not really, self-care. I'm like, well, it's mindfulness. It's getting your body moving, and sharing how you do that with your coworkers and with your family. And it's not about overindulgence. It's self-care is maintenance. It's similar that you brush your teeth at least once a day, at least, if not twice, or even more. But however, it's just like, how are you creating routine so it's regular and it's non-negotiable? And so, that's kind of where this is when we look at work related as to the emails and answering emails and always on the phone answering. And that's a culture that the leader of the organization can create, and what is acceptable and what is not acceptable. And that's really up to, and this is where the CEOs and the C-suite need to understand that they can control this. They can create a very healthy environment, and turning the mirror on oneself as far as how are you creating this and how are you creating a safe environment.
Makes a lot of sense. And that's just one resource that is very simply tangible. You set that yourself, but there are a lot of different resources available to individuals who are struggling or seeking help. What are some of the effective resources? And then I'm going to have, just warn you, a few follow-up questions on this specifically.
I think we can never find enough resources. However, and it's just to kind of begin, well, how do I even find anything to begin with? It's more or less that you don't know what you don't know. And just understanding that at first from a work environment, is EAP offered? And EAP, and what does that include? It's just EAP is mental health, it is financial literacy, it is so many things that are available to you. And as I've been speaking with some HR leaders and others indicating, and this was even when I was working at the university, is that people will be ready to receive information depending upon where they are, where their mindset is. Meaning that what is it that people need to know as far as their resources? When do they need to know it? And then how and what modality? Is it through an app? Is it through online Google search? Is it through paper? So going old school and such. What is that? And how do you, as an individual, what do you thrive on that is healthy? And so it's just beginning of just asking the question. That's even asking your friends, like, what is it that you have identified? I think we have so much information overload, even with social media. You can search on social media mindfulness activities near me, kind of a relaxation. And all of a sudden, even utilizing AI, you're going to be able to find some things that you're like, gosh, I never thought that a paddleboard place was really close by that I can rent, on a lake. And I'm like, I never thought of that. It's just kind of being creative. And this is where I've helped others. Allow AI to help you with that brainstorm to be able to say what's near me and reasonable as far as the cost. It's the peer support groups as well, just kind of peer support groups near me, because there's so many of these. Smart recovery program is one that are at no cost, but we gain by being in community. And that's really the terminology or the phrase of finding your people. Is it faith-based? Is it sport-based? Is it musical-based? Is it from a book club? What is that? Because that starts your relationships, and relationships are critical in that sense of belonging and within your own resources and mental health. The apps that I highly recommend, and I get no residual kickback whatsoever. We know about we know it about Headspace and Talkspace. I will always say, even when I do presentations, there's another app out there that it's an annual cost after the first year. So it's free for the first year. And it's called Balance. And I learned about this about 2 years ago. And I'm not one that likes to meditate, or at least for a long, I like that, or the thought of meditation will be for a half an hour or longer. This app actually is a guided meditation. You can set it for like 5 minutes or 10 minutes, and that's it. I'm like, oh, well, that's doable. I can try that to an extent. And so these are kind of just asking others, what do you use? And sometimes there are companies that actually offer these apps that might cost you at no cost at all. And then I would say, and I know I will talk a little bit about what NAMI provides, but before we talk about NAMI, I want to talk about crisis resources. We want to make sure that everyone knows about the national crisis line of 988. We know 911, but 988 is the suicide and crisis lifeline. Here in Broward County, 988 goes right into 211 with trained licensed clinicians that are able to refer you appropriately, or if you're in significant crisis, how they get you help immediately. I'm on a committee within Broward County that is looking at the 988 data, and we're able to see how the more advertising that we do, the more that people are recognizing how to leverage that and take advantage of it, which is wonderful. And then lastly, I'll say that from what NAMI and what we're able to provide, we're known nationally and then statewide, as well as then clearly with Broward County, that our support services, which are at no cost, free of charge, are peer-to-peer, meaning that we don't have licensed clinicians that run our groups, our support groups. These are peers that have gone through their own journey, that have taken a class, and then are able to facilitate the respective groups to be able to know how to support each other. Yeah, excuse me about that.
Bless you.
Thank you. And one thing that I'm really proud of with NAMI Broward is that we don't have a main office to which people come to us for the support groups. We go into the community. So if it's in Miramar, or in Sunrise, it might be at libraries or at community centers. And my hope over the next 5 to 7 years is that we're in almost every single municipality within Broward County. But this is what NAMI is known for, and is the peer-to-peer, mentor to mentee, family to family, because that is where, when you're able to be in group with others that are going through something similar to you, it gives you permission to even be more authentic and realize that, wow, I'm not alone, and this is what I've needed.
And I'm glad you bring up NAMI, because if you weren't, I was. I mean, I think it's so NAMI. I want to point out, we're saying NAMI Broward, and that's because we're located, our campus, the graduate school, the online division, we're located in Broward. Dr. Joe is located in Broward, which is why we're specifically saying Broward. But NAMI is not just in Broward County, Florida. NAMI is everywhere.
Right. Yeah. Yes, it is. And so as we have people that are listening to us or watching us to an extent, know that every single state has a NAMI state affiliate, and then each state is divided differently. So even when I was in Massachusetts, I was part of the Southeast Massachusetts NAMI. It wasn't Boston NAMI, or it wasn't, or a particular or Middle County NAMI. And that's where I would really recommend, is that as people are looking for the respective affiliate and in their area, to just go to the NAMI.org website. And then you're going to be able to then there's a drop down as far as what state. And then from there, you're going to be able to say, oh, what's near me, or what does it look like? And it's going down quite a few different rabbit holes. Each NAMI and NAMI affiliate is very different, meaning that we all offer very similar to our national branded programs, such as family to family, peer to peer, NAMI connections. And then, depending upon the county or wherever that particular NAMI is, there might be additional services that they provide because it's just needed in that area. So it's to be able to fill a gap. So know that there's commonality, and which is pretty awesome to be able to have this model that if you go to a peer-to-peer, or you participate in the peer-to-peer class or the family-to-family class, whether it be in Broward County or in Chicago or in Lincoln, Nebraska, it's going to be the same curriculum, which is pretty awesome to be. There isn't another model that's like that. So that's what we're very proud of as well. And then particularly specific offerings and resources to the area to which the NAMI affiliate resides.
I've always been impressed with NAMI since I learned about it. I didn't know about NAMI until I moved to Florida. And so I've been in Florida now since 2009. I'm not doing math apparently right now.
Really?
Number eluded me.
Yeah.
And it wasn't until I moved to Florida that I heard about NAMI. And then in doing my own homework, NAMI prioritizes education, community. There's peer-to-peer grief groups for adults, children, families. It's very impressive, this reach that NAMI has in the community when it comes to breaking the stigma. So definitely kudos to what NAMI is doing. And NAMI is very much here in the community in Broward County. I know Keiser has on a number of occasions participated in the 5K that is annually hosted. And we always enjoy that opportunity to just shed awareness to this conversation we're having. But
and we're so appreciative. I'm sorry, go ahead.
No, sorry. Can you tell us a bit more about the impact that NAMI has, locally? I think would be easiest for you.
We're so excited. So we clearly, and thank you we always look to Keiser as far as the support for our annual Mental Health for All walk, which will be held the first Saturday in October. We are looking to always increase awareness, and more teams for that is always needed. That is our major fundraiser for the year. We receive no funds from the state, or NAMI National as well. So whatever we raise within Broward County, that helps allow us to keep all of our programs offering at no cost. We have our administrative costs that are needed in order to implement the programs. So, and then, during Mental Health Awareness Month, we do have another program at the end of the month called Artful Minds, and you can find that on our website as well at namibroward.org. And it's held at Mad Arts in Dania Beach Art Gallery, whereby those that use art as therapy were able to showcase. And that's just beyond the pastels and watercolors and oil painting. It's also spoken word. It is sculptures. It is performances. So we're just really excited to be able to have that as a fundraiser for us as well. I'm able to say right now, I'm really excited. One of our impact partner, our entertainment impact partner, is Recovery Unplugged. So we're able to partner with a variety of different behavioral health organizations. And our featured performer is currently on The Voice, NBC and a finalist for The Voice. So Adam David will be spotlighted at the end of the month, and just really excited for that. And then one thing that I was looking at our team meeting this morning, in brand awareness and awareness about mental health in all the municipalities of Broward County is clearly very important. And so one of our initiatives that we do, and NAMI Broward, I think, is very unique from doing this even across the country, is that we reach out to every single municipality in Broward County and the commissions to ask if they would be willing to proclaim May as Mental Health Awareness Month. And so we were just looking, last year we were able to have 12 come on board. And I'm able to be there and accept the proclamation, but also talk about NAMI and what we do, and to challenge each municipality about more mental health awareness. And this year we have 27 that have come on. And so I'm just thrilled as far as, that awareness is becoming more and more. What can we do? So it really stems from awareness of who we are, and awareness of the impact that we have. And so even looking at the data from last year, and I came on board last year, that we increased our impact in the county by 44% of individuals that have been benefited or touched by NAMI. And it's been, so it's a little over 9,000, close to 10,000 that have benefited from our programs. And we're looking to meet that and hopefully exceed it this coming year in 2025. So again, it's awareness. We're with the Stigma-Free Workplace initiatives that we're doing, is really has been benefiting those that were not aware, and now recognizing that there's so much more to be able to do it. And everything that we do, Heather, it's always collaborations. We don't do anything by ourselves. So that's kind of even with our peer-to-peer, family-to-family. It's again through community centers or libraries, and we don't have anything again that we just do by ourselves, because we know that the value of collaboration and partnership is instrumental.
That's amazing. And like I said, I've been impressed with NAMI and aware of NAMI for a handful of years, and so impressed with the impact. And I can't emphasize enough what you just said is free services. Yeah. NAMI doesn't charge the individuals that need help. They're free services available, education, support groups, classes. It's an amazing organization to look into. So we're definitely honored to have you join us as we kick off Mental Health Month here at Keiser. So all month long, we're going to be having different conversations on our podcast, as well as special seminars that we're hosting for our students to have those different conversations that we need to have. And I can't thank you enough for kicking off the conversations for us this month.
Well, I so appreciate the invitation. If people want to go to our website, we're actually also selling as a fundraiser Mental Health for All t-shirts. And they're green, knowing that the mental health green, and we're utilizing really, I think it's May 15th as a universal Wear Green Day. So that would be wonderful to see Keiser University in green, if it's not on that day, but some social media to push it out there to represent mental health for all.
Yeah, no, I definitely think we can go green. I have my green ready to go.
Yeah, all right, there you go. Always wear that. That's great. Excellent.
Well, thank you, Dr. Joe, for these insights and having this conversation, like I said, with us. We're looking forward to this month's conversations, and it just made so much sense to get you out here with us first.
Well, thank you. Thank you again. And thanks, Keiser University, and hope everyone has a wonderful end of the semester.
Thank you. And the resources that Dr. Joe mentioned in this conversation, we're going to make sure that 988-211, NAMI, the Veteran Crisis Hotline, all those links will be in the comments below this episode. So check out the comments if you need links to any of those resources. And as always, if you've enjoyed this conversation and you want to hear more, you can check out Dr. Joe on social media, on his website. He's right now, this is his season and NAMI season to really take the forefront in the conversation. So you can search NAMI's website, you can search Dr. Joe's name, and you're going to find a few episodes of various podcasts, articles, blogs that are being published right now if you want to hear more from Dr. Joe. And if you've enjoyed this conversation, be sure to like, share, subscribe, and follow as we talk all May long about the importance of mental health. Thank you for joining us, and we'll catch you on the next one.
Thank you for journeying with us today on Keiser Voices, the Story of Success. As we close this chapter, remember, every story has its next page.